Hi there. And how are you today? Okay. Well, it's time to have that wisdom tooth out. How are you feeling about that? Well, it's perfectly natural to be nervous, but let me tell you that I have done this many, many times before, so you're in very, very safe hands. I'll talk you through what we're going to do today, and then answer any questions that you might have, and then we'll take that tooth out. And I promise it will feel much, much better afterwards. Okay? Great. So, we'll begin by numbing the area around the tooth. And we will use lots and lots of local anaesthetic, so you won't feel a thing. The only part of this whole thing that you will feel is that first tiny needle go in. Thereafter, you won't feel a thing, okay? Once you're nice and numb, what we do is we cut into the gum and remove the tooth. Simple as that. Once out, we'll stitch it up and you're all done. Sounds nice and simple, but it's a relatively quick procedure. And as I say, there'll be no pain from that tooth because it will be gone. We'll talk about aftercare. Once the tooth's out, you'll need a course of antibiotics, just a short course, and you'll need to take care of your face because, unfortunately, there's often a little swelling for a few days afterwards. But nothing too worrying. If you do worry at any point, come back to me, okay? So, do you have any questions for me before we begin? Okay. This shouldn't take too long at all. So I'll pop on some gloves and my mask and we'll get you nice and numb. Okay? Great. You can have your eyes open or close your eyes. It's entirely up to you. Okay. No problem. Just try and stay nice and relaxed. Take some deep breaths if you need to. Okay. Yeah. Okay. Okay. Let's just begin by having a quick look at this tooth, okay? So, nothing scary at this point. Just a mirror, like we've seen before. I'm going to just have a look, okay? Great. So, if you could open up nice and wide for me. Thank you. Okay. Thank you. You can close your mouth. You are definitely going to be better off once that is out. 100%. So, let's do that. Let's get that tooth out and relieve that pain. Okay? Fantastic. So, a needle for numbing. Just one needle. It's going to go in your mouth for a good few seconds and we're going to get it nice and numb, okay? Fantastic. Here we go. So, open your mouth for me, nice and wide. Okay, are you ready? Nice and calm. Great, here we go. You ready? Yeah. And around here. Well done. This really is the worst part. Once this is over, you'll start to feel nice and numb. Just for the next part, okay? Well done. Almost there. Well done. How was that? Okay, so we're just going to pause there because it takes 1 or 2 minutes to get to work. Okay. Still feeling okay? Great. Okay. So, tell me when it starts to feel a little funny. It might feel a bit tingly. It might just feel very odd. But just give it a couple of minutes and hopefully you'll start to feel some difference. If you still have some sensation there, I will simply put some more anaesthetic in there. So we won't begin until you are completely numb. Okay. So how long have you been in pain with this tooth? Okay. Well, it is definitely time to take it away then. And put it under the pillow this evening. I would imagine the tooth fairy will give very good money for a tooth of this size. Luckily, I can see it nice and clearly. I can't see any problems with taking it out. I've had a good look at all of your x-rays and things like that. It's looking absolutely fine. So it's nice and quick and routine. Okay. Good. So how's it feeling now? Can I just take a feel? Just on the outside. Okay. Could you feel that? Yeah. Okay. So we'll just double check. Okay, so if you open your mouth for me, I'm just going to tap around the gum and you can tell me if you feel anything, okay? Great. So, nice and wide for me. Can you feel that? How about now? Great. Now, okay, and I'm just going to touch the inside of your cheek. Okay, yep. How's that? Great, okay. Right, so you are nice and numb. Are you ready? Good. Let's take a couple of deep breaths in, and as I say, you won't feel this. The most you will feel is the pressure from me pulling that tooth. Okay, but certainly no more pain. Right, so 1 or 2 deep breaths and we'll get going. So, deep breath in for me. And breathe out. Lovely. Deep breath in for me. And out. breath in for me. And out. Well done. Right. What I will say is, once we get going, if there are any problems, if you want me to stop, anything like that, just pop up your hand. Give me a wave. One hand, both hands, whatever you need to do to grab my attention, and we will stop. If you want to stop completely, we absolutely can, or if you want to take a break, that's no problem at all. We're not rushed for time, okay? Super. Right, so firstly, we're going to cut into your gum, okay? Just so we can get at that tooth. Yep. A small cut, just into the gum, okay? So, opening nice and wide for me, and remembering to stay nice and calm. Okay, here we go. Yeah. One more time. Fantastic. Keep that mouth open for me. Let me take a look. Well done. That's fantastic. Just going to suction quickly in that corner of your mouth so we can keep an eye on what's happening. Okay, you ready? Good. You're doing really, really well. Well done. It's not nice seeing all of these scary instruments, so you're doing very, very well. Okay, so here we go. We're now going to pull the tooth out, okay? Just going to use these. Nothing to worry about. These are just precision ends, so I can get a really decent hold of that tooth. And you'll find in less than a minute now that tooth will be gone, and so will all the pain in the future. Okay, so nice and wide for me. Here we go, you ready? Fantastic. Here we go. Nice and still for me. Lovely. It's got hold of it really nicely. We're just going to give it a little wiggle, help it on its way. And say thank you so much, but it's time to come out. Ready? Here we go. Yep. Well done. Let's drop this in the bowl here. Fantastic. You okay? Good. All out. It's a little suction so we can see what we're doing. Ready? Good. Nice and wide still for me. Brilliant. Well done. Well done, that's the worst part of it over. Great. What I'm going to do, just before we stitch it, just pop this in your mouth for a second, just so that you can relax that jaw for me. This is just going to go in there for a second. Ready? Okay. Okay, well done. Right, close that jaw for me. We don't want any soreness here. How's that feeling? Okay? Good. Well done. Lots of patients come in very worried, very nervous. But actually it's quite a quick process. And in many ways, the stitching takes longer than the actual tooth pulling. So, okay, right. Let's take this out, and then what we'll do is we'll stitch up that gum. Okay. So, mouth open, but not too wide. Just so I can get in at that, okay? Thank you. Lovely. Thank you very much. Right. Have you ever had stitches before? Okay. No, that's absolutely fine. What we do is we take some stitches. There's a needle on the end here, and we thread it through and we pull it tight so it's nice and stitched. Okay. But what you'll see is what looks a bit like a hook on the end of here. And that will be what we use to pass through your gum. Now, I will say about these, they are nice and thin. Thinner than sort of a normal needle, but you'll see when we take it out. Okay? Yeah. And then that's you all done. Let's get this out. It's in a nice sterile package. Okay. You grab hold of this and I'll show you before we get started, okay? Lovely. Okay, so it is. You see it? What we'll do is this is the part that passes through the gum. We pull it nice and tight, as if we're sewing through anything really. Okay. Again, if there's any sensation other than kind of that odd numb sensation, then let me know and we can stop. However, this is what we need to do now. Okay. So, one more quick suction and then we'll get you stitched. Okay. You ready? Okay, here we go. Well done. Okay. Good. Good. So, 1 or 2 deep breaths for me again. Deep breath in. And out. Deep breath in. And out. One more time for me. Deep breath in. And out. Great. So one more time for me. Mouth open nice and wide. Okay, here we go. You ready? Nice and wide for me. Okay. Good. Really good. Well done. It's difficult to stay still sometimes when you can see what's going on. You're doing so well. Almost there. Well done. Couple more. Last one. Ready? Okay. Fantastic. Tie that off. Well done. Well done. Suction one more time. Okay, ready? Here we go. I'll go all around this time, rather than just the back. Well done. This side. Yeah. Wonderful. Well done. So, 2 of these. Okay, ready? Nice and wide for me one more time. Fantastic. One more. Ready? Good. Right. I will give you some of those to take away with you. Okay. Right, so I get that you don't want to talk right now, so we can do a thumbs up type situation. How are you feeling? Okay. I will say at this point, most people are feeling awe. Because it is a big thing. However, you will find in the next couple of hours that the local anaesthetic begins to wear off, and you will inevitably feel a little pain. So, absolutely take some painkillers, okay? And when you get home, get an ice pack straight onto that face, okay? Because it will begin to swell, simply because of what's happened here today, okay? I'm going to send you away with a short course of antibiotics to make sure there's no infection. And those stitches will dissolve on their own, so you do not need to come back to have those removed. Okay? I would hope that all of the swelling will be gone within a week or so. In the meantime, though, if you do have a lot of pain, or if something doesn't feel quite right, or if you don't feel well, or even if you would just like for me to take a look to check that everything's okay, then I am more than happy to do that. Okay? Wonderful. So, before I let you go, I'd just like to have one more look at everything to make sure it's all okay. Yeah? So, don't open too wide because obviously you've got that cotton in there. So just gently open your mouth. Okay, let's have a look. Perfect. Great. That's closed really nicely. Okay, so what I'd like you to do is take your time in getting up, okay? There's no rush. I don't need to be anywhere. Take your time, sit up carefully, make sure you're okay, everything feels okay, and then I'd like you just to sit in the waiting room for a little while. We need to sort out your antibiotics and things like that, but also just to make sure that you're okay and everything's okay before you go, okay? Well, thank you for doing so well today, staying nice and still for me, and doing so well in a situation that can be not so pleasant. But it was great to see you, and we'll see you again soon. Take care of yourself.